NUS nursing faculty and graduate students conduct research and test interventions designed to tackle existing healthcare challenges. One of our research pillars covers chronic illness and long-term care. As convener of this research pillar, I mentor aspiring researchers and closely work with a team of passionate and dedicated researchers who study the determinants of quality of life. We explore innovative nursing interventions in promoting and improving self-efficacy, health and well-being of patients with chronic illness and on long-term care. Our research focuses on three main areas. To promote quality of life in patients with chronic and long-term illness, to promote health in patients with life-limiting illness, and to promote healthy aging in older people within the community or long-term care settings. A combination of Singapore's aging population and propensity for unhealthy lifestyles have contributed to an increasing prevalence of chronic diseases. 1 in 4 Singaporeans aged 40 years and above has at least one chronic disease such as coronary heart disease, heart failure, diabetes, or cancer. The onset of these diseases invites a slew of health complications that results in high medical costs or even hospitalization. In most cases, dedicated caregivers are required to manage the activities of daily living, medical treatment, or palliative symptom management. Furthermore, with the rapidly rising elderly population in Singapore, diseases such as Alzheimer's disease or dementia are also increasing. With advancement in medical technology and increasing health literacy, these complications can be prevented through early detection and management. It is therefore imperative that research is conducted to find solutions that encourage primary prevention, assist in secondary disease management, and promote healthy aging in the elderly. The Ministry of Health and National Medical Research Council offer research grants to meaningful research projects that align with national healthcare priorities to directly address key challenges in the healthcare industry. Only a handful of impactful research proposals are selected each year based on its impact on health delivery outcomes. Over the years, we have secured a number of competitive grants. Using these grants awarded by the NMRC, NUS nursing researchers have conducted studies with novel interventions that aid in chronic illness prevention, support, education, and health promotion. The results of these studies have contributed to community healthcare resources, reduced health service utilization, and promoted better understanding in chronic illness prevention and management. Take, for example, my recently completed study funded by the MOH Health Service Research Grant. This study evaluated the effectiveness of a nurse-led, home-based and self-managed psychosocial educational intervention for patients with heart failure in Singapore. The results of this study showed that the intervention was effective in improving self-care, cardiac self-efficacy, psychological well-being, health-related quality of life, and functional status. It also reduced unplanned health service use in Singapore. Furthermore, the toolkits, educational resources, and a mobile application developed in the study are now made available for heart failure patients and staff in the National University Hospital. Building on the study, my team and I have developed the Integrative Cardiac Rehabilitation Employing Smartphone Technology (ALCNS) project, which recently won a substantial grant from NMRC HSRG. The randomized control trial tests the effectiveness of an integrative, home-based and smartphone-based cardiac rehabilitation program. If successful, findings from this study can direct healthcare professionals to adopt novel models of healthcare delivery in Singapore. As a world-class institution, our research not only impacts the healthcare industry but also the academic world. To date, my team and I have published over 200 peer-reviewed papers in international medical and nursing refereed journals. As a team, we are committed to building thought leadership at NUS Nursing to contribute to advancement in nursing science and practice across the university and the nation. We have also established national and international research collaborations for the university. Shared research ethics and mutual recognition of one another's research specialties have resulted in many collaborative papers. The feedback on one another's work offers different perspectives to our research. Continued collaboration with these professionals has afforded us mutual opportunities to learn and expand our research repertoire. Despite the current global pandemic, like-minded researchers from around the world could still meet up through platforms like Zoom. This ensures a continuous sharing of ideas and concepts that can be further developed in other cultures within the safety of our homes. Ideas and innovations that are successful in other countries can be applied in Singapore's local context to test for its transferability, offering new interventions that might potentially change our healthcare delivery and prevention techniques. In the research process, NUS Nursing upholds its commitment to develop researchers of tomorrow. Graduate students are taking master's or PhD programs, are trained to conduct primary research at the highest standard under the supervision of experienced researchers in the department. The students are involved in the research process every step of the way, from writing grant applications to conducting the intervention and analyzing research outcomes. Finally, they publish their findings. For the ICRAS project, a PhD student under my supervision has already made great strides, publishing a systematic review paper on the effectiveness of home-based cardiac rehabilitation in the Europe Journal of Preventive Cardiology, which is a highly regarded journal with an impact factor of over 7.8. Here at NUS Nursing, we are nurses at heart, equipped as researchers in search of solutions to today's healthcare challenges. In the face of challenges posed by chronic illness and long-term care, we discover innovative ideas and interventions that can prevent disease, manage symptoms, and promote health.